Miss Arian Jamie Sparrow is a 26 years old nurse who was residing in Bitas, Cabanatuan City. Before she became a nurse, she wants to pursue her mass communication but ended up taking nursing in St. Louis University. She spent her 4 years away from her family, and after passing the board exam, she followed her mother in Saudi Arabia to help their family in the Philippines. After 10 years of working as a nurse in other countries, she is now happy working in UK.
After you passed the board exam here in the Philippines, what is the first thing you did? Well, I remember passing the licensure exam around July of 2013, and I immediately submitted my application for a volunteer nursing job in one of the provincial hospitals in Cabanatuan around August. And I think I've been doing the volunteer work for like 2 years in pediatric ward. Then, why do you want to work abroad? I wanted to work abroad to challenge myself, get out of my comfort zone, and experience other healthcare system to grow as a professional and as an individual as well. And it's really nice to meet other people and experience their culture. Does working overseas help you grow as an independent individual? Well, working abroad really helps me professionally and personally, because I was able to gain more confidence with my work, and that's it. How do you manage homesickness? I seldom feel homesick, especially with the technologies nowadays, so you can just call your family, and going out with friends, doing some chores to keep you busy also helps. What are the major challenges and benefits associated with a culturally diverse workforce? So for the challenges, it's one of the main challenges is communication, especially in a country whose first language is not English. And one of the benefits, I think, is to be able to meet new people and experience their culture and learn new languages. How difficult is it to work with other nationalities and ethnic groups? Well, I think at first it was a bit difficult for me, but I was able to adapt. And I think as long as you communicate well with them, you can overcome these difficulties. Are you happy with your profession? Why and why not? Well, I remember when I was still a student nurse, I had thoughts of shifting courses, but when I found out that nursing is a very challenging and exciting profession where you can learn new things every day and you can touch other people's lives, I think it's very fulfilling. So I'm confident saying this, that I'm happy with my profession.
Antonio Figueroa Gabriel was born on 12th of June 1968 and was residing in Aduas Fajardo, Cabanatuan City. He graduated with a degree of Bachelor of Science in Nursing, year 1989, in Wesleyan University, Philippines. He worked as an ICU staff nurse in University of Santo Tomas for 5 years and became a clinical supervisor for his one final year in UST. He also worked as a clinical instructor in Pamantasan ng Lungsod ng Maynila for 2 years, and there he also finished his master's degree in nursing. He wanted to challenge himself more, so he decided to work abroad. At first, he was hired as a staff nurse in Longwood Medical and Academic Era in Boston, and he was promoted as a chief nurse in Kaiser Permanente in Oakland, California, up until this day.
I worked in UST Hospital for 6 years, from emergency room to ICU staff nurse, back to emergency room as head nurse, and my final year in UST Hospital as a clinical supervisor. I also worked as a clinical instructor in Pamantasan ng Lungsod ng Maynila from 1993 to 1995, where I finished my Master of Arts in Nursing. I joined various nursing association while I'm working in the Philippines, like Philippine Oncology Nurses Association, Association of Nursing Service Administration of the Philippines, to mention a few. If your job is no longer challenging, it's okay to try something else. So I decided to apply to work in USA here in California to improve my skill, better career opportunity, and being honest to you and to everyone, a high salary to support my family. I honestly don't feel I can put how much I actually learn into words. I learn a lot personally and professionally. It changes the way I see myself. If you work in a foreign country, your adaptability, flexibility, and your communication skills are going to improve. And a chance to work with a different people to achieve a common goals. Working overseas give you a chance to grow personally. It will help you to understand yourself more and your wants and needs. Yeah, it's true. You face a lot of difficulties and challenges, but it will help you to equip yourself and make you a better individual as well as a better professional. How can I manage homesickness? Homesickness is an acute form of anxiety, especially when you disconnect from your family and familiar places. You feel being forced out of your routine. I came here in California when I was 25 years old. It struggled during those times way back 1996 due to limited internet access. No Facebook, no Yahoo Messenger, no Viber, unlike today. Hearing any news from your family back home is very limited. Only letter from once a month is what I was looking forward to. To reduce my homesickness, I started making friends from work and created daily and weekly routine. California has a lot to offer. I started hiking and going to the beach, visiting mission churches. And one time I enrolled in community college to learn how to speak Spanish language. America is one of the most diverse society in the world. I have to be cultured. I need to learn to embrace others' culture. I need to develop cultural competency, meaning to increase my own awareness to people in my workplace. It's very important for me to have open-minded toward other cultures and respect other opinion as an opportunity to learn. My hospital has a mandatory cultural diversity online class to be completed every year for all employee for us to be more tolerant and understanding. A good example is to embrace millennial nurses like you. Nurses with multicolored hair, tattoo, piercing, compared to traditional nurses when I was in college in the 80s. I have to learn to respect other religious belief influencing their decision making. The most important is respect and accept differences of others. There's a lot of benefits in cultural diverse workplace, like inspire creativity and drive innovation. It makes business more profitable and competitive, and it allows to attract and retain the best talents. And also it's more productive and perform better and a greater opportunity to personal and professional growth. There are many barriers erected by cultural difference, especially between patients and nurses, like when the patient don't speak the same language. Providing care and making the patient feel comfortable and cared for is very challenging. Example is getting consent for a procedure or surgery. If patients primarily communicates in their native tongue, they stress and scared. In our hospital, we use qualified bilingual staff to explain to the patient, or we use video recording interpreter to educate them for any procedures or surgery they're going to have. Some ethnic groups have different ways of thinking about healthcare and go against Western medicine, like Native American against life support, or Chinese woman born in China wants to use traditional herbal medicine or acupuncture. What we have to do is to strive to learn, be open and positive. You have to explain what you are doing and why, or else they can lead to a breakdown of trust and rapport between you and your patient. I can imagine myself being happy doing anything else. I've been a nurse for 31 years, and being service for others is rewarding. But it is hard. I gave a lot of holidays. I missed a lot of birthdays because you are on duty. I work mostly with colorectal, urology, and surgical team. I'm dealing mostly cancer patients. I hold their hands when they are in pain. I'm with them when they receive a good news. And I'm comforting them when it's bad news. Not many professions get to be part of the human experience like us. I love being a nurse.